Imagine this. You went to see a doctor for a condition, but instead of getting easily treated, you are actually drowning in medical debt. Your costs keep piling and piling. What I just described to you is a very real scenario many Americans today face. Healthcare in the United States is flawed. Today, I am going to persuade you on why the United States should implement a single-payer healthcare system. Healthcare becomes a big concern as you become an adult and start to be out on your own. Understanding the flaws in the system is beneficial to everyone in this room, and because you can be persuaded on why the United States needs a new and better system. I know a lot about this topic, and I've written multiple argumentative essays on it. Today, I'm going to talk about inequality in healthcare, how money is wasted, and how a single-payer system would fix these problems. So, first, we need to understand inequality in health. And according to Kimberly Amaito, Masters in MIT Business Management, the total healthcare costs in the United States in 2018 add up to $3.6 trillion. These costs have risen faster than the median annual income, meaning that to see a doctor costs more than entire salaries do. And these high numbers cause disparity gaps. According our paper titled Income Inequality in Population Health, published in the Journal of Epidemiology and Community Health, shows that lower income people have limited access to healthcare services. And because of this, they often have poor physical and mental health than wealthier people. And sadly, they die more often and at an earlier age because they can't afford healthcare treatment. And Canada has a single-payer healthcare system, which ensures all of its citizens have access to healthcare, according to Mehmet Okudan in the Encyclopedia of World Poverty, and it's shown to have higher income equality and lower death rates. Now that you understand the inequality within health, let's talk about how money is wasted. Another problem besides health inequality is that money is heavily wasted in the healthcare sector. Ruza Tekinen, a researcher on health policy, writes in a Commonwealth Fund journal that the United States spends the most on healthcare in the world, yet it still has an unhealthy population. People spend the most amount of money on healthcare with covering the large amounts of costs for private insurance payers, which shows that the current multi-payer system we have is actually what makes things so costly. And out of all high-income countries, the United States has the most premature deaths that are caused by diseases that aren't treated properly. And it has the highest obesity rate, and people have more lifelong diseases. Even though Americans spend the most on healthcare, they are sicker because they actually are shown to see the doctor less than people in other countries. This is because so many of them cannot afford to do so. Now that you understand the problems with the current healthcare system, I am going to persuade you on how a single-payer healthcare system would solve these issues. So currently, the United States has what you would call a multi-payer healthcare system. This basically means that you can find insurance in many different places, from different private insurance companies or government-sponsored programs. However, this is what causes inequality, high cost, and high deaths. Eric Schneider, MD, a health service researcher, writes in the New England Journal of Medicine that the many private insurance companies are actually complicated and inefficient. Many of them offer little information to patients about what health services their plans cover, and they have a lot of unexpected bills which amount to a high cost. Without these barriers accessing healthcare, people would get treated faster and they would have better health. Having a single-payer system, which would be the government ensuring everyone has access to coverage, is shown to save the crippling cost of healthcare and gives everyone universal access to to doctors and hospitals. This helps to fix disparity gaps and helps to fix the low quality healthcare that causes all the preventable deaths. While many also argue that single-payer healthcare is too difficult a process to switch to, it can actually still be attained. First, other countries, such as Canada, already have single-payer healthcare systems, and they spend way less money on healthcare and have healthier citizens all around. Also, government healthcare is not a new thing. Government-run programs already exist today, such as Medicare and Medicaid. However, under a single-payer system, they would simply be expanded and made universal to people, while also eliminating private insurance companies. This concludes my argument on why the United States should adopt a single-payer healthcare system. So all in all, healthcare is an important thing to learn about as you start to reach adulthood. It's beneficial to understand the flaws in the system as you start to find your own plan for getting healthcare. To review what we've learned today, the healthcare costs in the United States adds up to trillions, which causes disparity gaps where many people can't afford to see doctors. The United States is the top spender on healthcare in the world, yet its people die more often and earlier in life, and they're sicker. And a single-payer healthcare system would solve these aforementioned issues by having the government expand access and make sure everyone can access healthcare, which ensures cheaper and higher quality care. I hope that today I've persuaded you enough to want to take action against a system full of inequality, high cost, and high deaths that can't be prevented. Healthcare is a human right. Take action against the system. Support campaigns advocating for single-payer healthcare. Help fix this system. Thank you.